The bones of the foot are the tarsal bones, metatarsals, and phalanges. Tarsal bones are the calcaneum, the talus, navicular, cuboid, and 3 cuneiform bones. Only the talus articulates with the tibia and the fibula and the ankle joint. The calcaneum is the largest bone of the foot and forms the prominence of the heel. It articulates above with the talus and in front with the cuboid. It has 6 surfaces. The anterior surface is small and forms the articular facet that articulates with the cuboid bone. The posterior surface forms the prominence of the heel and gives attachment for the tendon calcaneus, Achilles tendon. The superior surface is dominated by 2 articular facets for the talus, separated by a roughened groove, the sulcus calcaneum. The inferior surface has an anterior tubercle in the midline and a large medial and a smaller lateral tubercle at the junction of their inferior and posterior surfaces. The medial surface possesses a large shelf-like process termed the sustentaculum tali, which assists in the support of the talus. The lateral surface is almost flat. On its anterior part is a small elevation called the peroneal tubercle, which separates the tendons of the peroneus longus and brevis muscles. The talus articulates above at the ankle joint with the tibia and fibula, below with the calcaneum, and in front with the navicular bone. It possesses a head, neck, and body. The head of the talus is directed distally and has an oval convex articular surface for articulation with the navicular bone. This articular surface is continued on its inferior surface. There it rests on the sustentaculum tali behind and the calcaneo-navicular ligament in front. The neck of the talus lies posterior to the head. Its upper surface gives attachment to ligaments and its lower surface shows a deep groove, the sulcus tali. The sulcus tali and the sulcus calcanei in the articulated foot form a tunnel, Sinus tarsi, which is occupied by the strong introsseous talocalcaneus ligament. The body of the talus is cuboidal. Its superior surface articulates with the distal end of the tibia. Its lateral surface presents a triangular articular facet for articulation with the lateral malleolus of the tibia. Its medial surface has a small, comma-shaped articular facet for articulation with the medial malleolus of the tibia. The posterior surface is marked by 2 small tubercles, separated by a groove, for the flexor hallucis longus tendon. Numerous important ligaments are attached to the talus, but no muscles are attached to this bone. The navicular bone is featured with the tuberosity, which can be seen and felt on the medial border of foot, 2.5 cm in front and below the medial malleolus. It gives attachment to the main part of the tibialis posterior tendon. The cuboid bone has a deep groove on the inferior aspect, which lodges the tendon of the peroneus longus muscle. Here it is. The 3 cuneiform bones articulate proximally with the navicular bone and distally with the first 3 metatarsal bones. Their wedge shape contributes greatly to the formation and maintenance of the transverse arch of the foot. The metatarsal bones and phalanges resemble the metacarpals and phalanges of the hand, and each possesses a head distally, a shaft, and a base proximally. The 5 metatarsals are numbered from the medial to the lateral side. The first metatarsal bone is large and strong and plays an important role in supporting the weight of the body. The head is grooved on its inferior aspect by the medial and lateral sesamoid bones in the tendons of the flexor hallucis brevis. The 5th metatarsal has a prominent tubercle on its base that can be easily palpated along the lateral border of the foot. The tubercle gives attachment to the peroneus brevis tendon. Each toe has 3 phalanges except of the big toe, which possesses only 2.